Awareness of the diaphragm. Please draw your awareness to your respiratory diaphragm, which resides at the base of your rib cage and separates your rib cage and your abdominal organs. And so take a moment to draw your attention to this diaphragm in the front. And then follow your ribs down along the sides of your body to feel this on the left and right. And then further follow it along to the back of your rib cage. And now we're going to spend a little bit of time in each of these areas, noticing what it feels like to bring your attention and your breath to these regions. To begin, please place one hand on your breastbone and the other hand at the very base of your rib cage, top of your belly, where the front of your diaphragm is attached. Can you notice if there is any natural movement happening underneath your hands? Just observe it for the first few breaths here. And then see if you can quiet the movement underneath your top hand, your breastbone, and just invite a little bit of movement of the bottom hand of the diaphragm moving forward on your inhale and letting that area soften as you exhale. Let the breath be gentle, inviting the diaphragm to expand on the inhale and relax on the exhale. Enjoy a few more breaths here with your attention at the front diaphragm. And then let go of that specific focus and just notice how you're feeling in your body, in your mind, after focusing your attention at the front diaphragm. And now please bring your awareness to the left and right sides of your rib cage, the lowest part of the rib cage. And if you'd like, you can place your hands here, either left on the left and right on the right, or you can cross them so that you're giving yourself a hug. Notice any movement here. And then gently see if you can invite a sense of a little bit of expansion on the inhale and a softening on the exhale. Often people will refer to this as bucket handle breathing. So if you could think of picking up two buckets, one on your left and one on the right, and the handles lifting up as you inhale, and then softly lowering them down as you exhale. And again, please don't force this. It's just a gentle invitation for a gentle little movement of pulse, of the ribs moving out, left and right on the inhale, and releasing back down on the exhale. Please enjoy one or two more breaths here. And then let go of this technique, and again, check in. How do you feel after breathing into the left and right sides of your diaphragm? And now, draw your awareness to your back lower rib cage. This is also where the kidneys live. And you can either just have your awareness here, or if you're sitting up against a tall chair or lying on your back, you can feel how this back aspect of the body is in contact with something solid. Or you can, if you have flexibility, bring your hands to your lower rib cage, cupping each kidney space. But if that feels in any way uncomfortable on the shoulders, just bring your hands forward, just draw your awareness back here. And now can you notice if there is any movement that happens with your breath in this area of the lower back rib cage? And now see if you can feel this area start to expand, to kind of puff open on each inhale. And with each exhale, can you invite that just to soften ever so gently? If it helps, you can kind of visualize you have two small balloons where those kidneys are. And with each inhale, you're inviting them to expand, to inflate. And as you exhale, they gently deflate. And it's just a gentle puff of air, inhaling, expanding, and exhaling, softening. Inviting the breath into your back body, into that back diaphragmatic area. Enjoy a few more breaths here. And then slowly transition to observing how you feel. Is there any change in how you're experiencing the sensations, feelings after breathing into the back area of the diaphragm? And now finally, can you draw your awareness to all of these points at the same time? The front of the diaphragm, the left and right, and the back. And as you breathe, can you invite these areas to gently expand in their circumference as you inhale, and then soften in that circumference as you exhale. And it's a gentle pulse, no pushing, no force, simply an invitation to expand in 360 degrees of this circle, radiating out and relaxing in. After your next exhale, please let go of the technique and just notice how you feel in this moment. Notice if there are any changes. Notice how bringing your awareness to the movement of your diaphragm has affected you. And know you can always come back to this practice by just bringing your awareness to your breath.